So, Karen, I understand you have low back pain.
Yes.
And what sorts of things have you tried for your pain in the past?
Different medications and some shots.
Okay.
Things have given me a little bit of relief.
Have they helped you to function better and live the life that you'd like to live?
No, not
Not
exactly.
really taking the pain away that far.
Oh,
So I wonder if you might be willing to consider a different way of thinking about pain. Beyond shots or medications, there are other factors that may contribute to pain, and I wonder if you'd be willing to kind of talk with me today about some of those strategies.
yes.
So Karen, I understand you have some low back pain.
Yes, my lower back.
And do you have a sense about what makes that pain worse?
Standing, lifting.
Sometimes does lifting make it worse routinely all the time, do you think?
I think it does.
You have grandchildren, I know. For example, do you sometimes have a hard time, does it increase your pain to lift your grandchild?
I avoid lifting my grandchild.
Why do you do that?
Well, I might really hurt myself.
You know, what you're saying is important. It's normal. It's typical that people find that they avoid things out of a sense of fear. Are you aware of fearing that you might be doing some damage if you lift your grandchild?
Yes.
To yourself?
Yes.
Making the back pain worse or hurting the disc in your back more?
Yes.
So that's what we call catastrophization, where we fear that we might be doing something worse, and that adds to our sense of pain, that contributes to our pain experience. So it's not just the pain of physically lifting, but it's also the fear that we bring to that situation.
Okay.
Are you aware of other things like that fear that make your pain worse in your everyday life?
Daily tasks.
Like, again, like doing things around the house.
Doing things around the house. I avoid sitting on the floor and playing with my grandchild.
Mm-hmm. Are there times that you're aware that stress or other psychological elements seem to make your pain worse?
I've never thought about that before.
So one of the things that we might consider doing that might be helpful to you is having you begin to keep track of things that might be contributing to your pain experience. Lifting and bending and stooping and so forth, you've already identified. But the fear that you might be doing yourself damage, the avoidance of activities that otherwise might be pleasurable or important to you, stress in your life, and other psychological factors that might be contributing as well. And we would ask you to do that as a part of homework that you do during this week, where you keep track of those things, and then we can talk about it the next time we meet. Does that make sense to you?
It does make sense. And at times before I do something, I notice I'm very tense. And yeah.
So keep track of that.
Okay.
And let's see if we can begin to expand. Most people need to expand their sense of what is contributing to their pain and what's leading them to the sense of feeling out of control that chronic pain so often brings with it.
I think you're onto something here.
Can you do that for me?
I certainly can, yes. Thank you.